Of housekeeping rules. Before we start, this webinar, as I said, will be about an hour. We will have a Q&A session afterward, and the Q&A session will start around 3:40, 3:45. So please remember that you can type your question and answers in the section below. Do not use the chat for your questions. It's not very practical. So, panel discussion. Can I see the next slide, please? Yes, perfect. Thank you very much. So our speakers, as I said, thank you very much to our panelists for accepting our invitation to join this informative session. We have Dr. Thomas Mourez. Dr. Thomas Mourez is a Health and Social Development Attaché at the Embassy of France to Vietnam. Thank you very much. We also have from International SOS, Dr. Jean-Samuel Wartel, Medical Director, Assistance Services Asia. Thank you. And Dr. Phi, Medical Director, Vietnam. Thank you very much. And for the legal aspects, DFDL, represented by Madame Marion Carles, Senior Legal Advisor, APAC. So maybe we can go further to the next slide for the agenda. Thank you very much to the panelists, and we can have a quick look at the agenda. As I said, it's a very short format. We will try to address all the topics in 60 minutes. So I'm giving my brief introduction, and if I can see the next slide, please. Okay, so I will just let you know what is the agenda. We will have a keynote remarks by Monsieur Dr. Thomas Mourez, then a roundtable with Dr. Phi from International SOS, and then Mr. Dr. Jean-Samuel Wartel, and then Madame Marion Carles from DFDL, and then followed by questions and answers, as you can see right now on the slide. So I will, if you don't mind, I will give you a little bit of insights on CCIFV, like a few minutes before we start. Can I have the next slide, please? Can you? Yeah, okay. So promote, support, connect. This is CCIFV. The French Chamber of Commerce is in Vietnam since 1989. We have around 250 members here in Vietnam, but we are part of an international community of French chambers all over the world. We have 124 chambers in 95 countries, which represent 37,000 members worldwide. We have 20 board members elected because we are a member-based association. We have 18 multicultural collaborators, and we are also part of Eurocham community with 1,000 members. Next slide, please. So regarding the 250 members, by the way, if I may say, this is why we also have this webinar in English, because within the 250 members, French companies, Vietnamese companies, international companies, some of our members do not speak French, and this is why it's also great to address this very crucial question in English as well. Our services, I would say two subgroups. One is, I'd say, the business club with communication and events, with a lot of different type of events, publications, and our sector committees. On the business support side, on the left, you can see commercial support, company setup, business center, recruitment and training, CSR, trade fairs. Basically, we try to address all the needs of any French or European company trying to come and develop its activities in Vietnam, but also the other way around to help and support Vietnamese companies in the region and in Europe. I give you an example on the next slide. You can see what we do on the website. It's very dense. We have a lot of information, and you can see, for example, a screenshot on the website, and we see everything we prepared on the entry permit. We try to gather information to make it easier to understand. So please do not hesitate to go on the website to understand more what we do, all the information we share, and what and who are our members. Thank you very much. Maybe next slide. So the topic today, as you know, Vietnam has launched its vaccination campaign in early March 2021. And today we have a special guest, Dr. Thomas Mourez, to answer some questions. I will be very general. Maybe you can let us know what is the current situation in Vietnam, what is your outlook on the situation, and maybe could you update us on the COVAX program in Vietnam, because we heard a lot and we had a lot of requests, so it would be great to have some insights from your side. Thank you.
Thank you very much, Adam, for your kind introduction. Can you see me on the screen? I wish yes. If not, I'm just going to speak. It's okay. I'm really pleased to be part of the invited panelists today, both as the representative of the French embassy in Vietnam, of course, but also as a virologist who has worked on the coronaviruses and the vaccines for quite a long time, both in France and in Asia. As you know, the current health crisis is unprecedented in more than a way. Firstly, by the speed of the dissemination of the pandemic, since we have seen the majority of the countries in the world affected in a few weeks, and a very significant number of deaths in a very short time. Of course, we have had recent examples of such pandemic, like the H1N1 influenza in 2009. But in our recent history, we have never witnessed such a blistering and deadly epidemic at the same time. The epidemic is also unprecedented in terms of economic consequences. Everybody has seen it. Never has the world experienced such an epidemic slowdown, with a brutal global recession and huge deficits, which ran into the trillions of dollars. Our societies have experienced many outbreaks, of course, but the weight of this one is concentrated in a very short period, forcing the states, the companies, and also the individuals to go into massive debts in a very short time. But alongside all this, the current health crisis has also led to a unique solidarity taking place around the world. The scientific cooperation has thus been exemplary, and it has made possible to generate and disseminate knowledge to an unequaled level. The best example lies in the vaccine research. Never in our history have so many vaccines been invented, tested, approved, and released so quickly. Of course, all the conditions were met to facilitate this vaccine development. And first of all, an unrivaled financial investment for any disease. All the countries in the world have raised money to develop solutions to deal with the pandemic, and especially in the field of vaccine. The second thing is that this development of vaccine has been based on solution technologies that were developed for at least 20 or 25 years. The messenger RNA vaccines or the adeno-based vaccine were developed at the beginning of the century, but there was no epidemic to scale up, in fact, these kind of models of vaccine. Of course, all the administration in the world have had facilitate all the validation of the projects by emergency procedures in order that every scientist in the world can work as quickly as possible. The fact also that this virus was really contagious with a very fatal disease, in fact, made it simple to assess the efficacy of the vaccine in the phase 3 trials. And finally, all the recruitment was facilitated by the number of people volunteering in the clinical trials. Usually, when you make clinical trials, you need months, sometimes years, to have enough people involved in the clinical trials, and this time only a few days were needed to complete all the recruitment. So the urgency allowed a synergy between all the actors and showed that a collective work made it possible to do great things. Thus, this health crisis has shown that in an emergency, large-scale international solidarity was also possible. France which was affected by the COVID at the very beginning of 2020, you remember, was, for example, really sensitive to the gift of masks from Vietnam when we needed the mask the most. In return, France has been among the most active countries in setting up the international Act-A initiative for access to COVID-19 tools accelerator. We indeed, at the beginning of the pandemic, believed that it was intolerable that certain countries had access to all the tools to fight against the pandemic, and some other countries have no tools to deal with it. In a few words, the Act-A, so Access to COVID-19 Tools Accelerator, is a multilateral initiative which is led by the World Health Organization, which aims to coordinate a global response to COVID-19 that is fair and united. Indeed, as the President of the Republic of France, Emmanuel Macron, recalled at the United Nations General Assembly at the end of 2020, the only effective response to the pandemic will be global, will be coordinated, and will be united responses. The pillar of this Act-A initiative, dedicated to the vaccine, is named COVAX. So you have all heard about the COVAX. It is a joint effort to purchase and to finance the COVID-19 vaccine with all the participants of the initiative. So most of the countries, in fact, attend to this COVAX initiative. Thanks to its advanced market commitment procedure, this initiative, this COVAX initiative, offers 92 low and middle income countries enough doses of vaccine to protect 20% of their population, which is considered by the country as a target priority. Vietnam has thus benefited from more than 2 million doses of vaccine until now, and should receive nearly 38 million doses of vaccine by the end of the year. The Republic of France is among the main contributors of this initiative and will continue surely to help other countries until the end of the pandemic. So thank you for your attention for this short introduction. I will stay with you to answer your question at the end of the event. Some of you probably saw that the French embassy is currently working with the Vietnamese authority to, with the objective to bring vaccines to Vietnam for all the French community and the workers of the French operators and their family in Vietnam. And I will be happy to answer your questions on that at the end of the meeting. In the meantime, I leave the floor to Adam.
Thank you very much, Dr. Thomas Mourez, for these insights. And indeed, we'll come back to you during a Q&A session. I'm sure we have a lot of questions, but you answered a lot of them already. So thank you very much. I will do a quick transition to the next speaker because Vietnam is currently in the middle of a fourth wave. As we know, some of you are joining us from abroad, but the wave started on April 27th and today has resulted in many new cases. So our speakers from International SOS will tell us a little bit more about the situation. So Dr. Phi TRUONG is a medical director of International SOS in Vietnam. Dr. Phi, the floor is yours. Can you let us know about the variants, the testing, the quarantine, and the vaccination in Vietnam?
Okay, good afternoon, everyone. Thank you, Adam. Thank you for having me. So let me give you the update for the COVID situation outbreak in Vietnam first. So, you know, Vietnam, we are in current outbreak now. This is the fourth wave in Vietnam. So this one, I can say a more challenging compared to the previous one. So up to today, there are more than 8,000 case report for this current outbreak. So it's spreading over 40 provinces in Vietnam now. However, most of the provinces report less than 100 cases. Only you can see only the top 5 in Vietnam from Bắc Giang, Bắc Ninh, Ho Chi Minh City, Hanoi, and Da Nang, where report over 100 cases. So the average now is 1 to 200K per day. So that means every week we have a report from 1,000 to 1,500K. But the challenging is not yet this slightly. The challenging is, you know, the virus now, the pandemic now attack the industrial zone. So where report more and more case. And there is no statistic of the hospital rate. But however, in Ho Chi Minh City, the local health authority, they report that the severity increasing a bit from 3 to 3.5%. But however, the death rate is still really low. So compared to the other country. So next slide, please. So what is different from this current outbreak compared to the other? So as you know that the government report that in this outbreak, there is 2 variant report, the Delta and the Alpha one. There are some new regarding in Vietnam, they have detected a new variant, the hybrid one, but actually this one is not confirmed by WHO. So we need more research, more investigation before we say a new variant in Vietnam. Regarding the quarantine, you know, now the government, they are very strictly on it. They change the number of the day quarantine from 14 days up to 21 days. So this one apply for immigration and even for close contact people. In Vietnam, we can't have one person. But however, more and more people in quarantine now. So now government, they working for the guidance to approve for the close contact people F1 to do a home quarantine. So that is the new. And regarding the testing, you know, this outbreak, the government now they approve to do a rapid test, which not happen in the past. You know, in Vietnam we do PCR only, but now this rapid antigen test is very good tool to manage the outbreak. You know, they can come to the factory, come to the office, in the building. They do a few thousand tests over the night. So that is very good tool. They got it go into control well. And another one is the restriction. You can see that is very challenging now. You know, each province they have their own restriction. They have stopped the people to move in to travel. They have more difficult. So this one is really challenging nowadays, especially from Ho Chi Minh City to travel around in Mekong Lake now is very difficult. Next slide, please. Okay, regarding the vaccine, so what is the progress of the vaccine in Vietnam? So you see, Vietnam, we are one of 92 poor country. So we got the support donation from COVAX facilities. So since February, we already received AstraZeneca vaccine from COVAX facility, and we start the campaign from the beginning of March. But I can say Vietnam, we do a little bit slowly about the vaccine compared to the neighbor country. So up to now, after 3 months, they only over 1,500,000 people got vaccinated, and only 50,000 people got fully, that means 2 doses. So in Vietnam right now, we have AstraZeneca from COVAX facility, and we have a little bit, only 1,000 doses of Sputnik V. This is the gift from Russia. But the government, they are working on this. They want to open on every channel to support, to import the vaccine. And you know, after 1,500,000 people got a vaccine, and they have report the good thing that they very rarely case report with the severe reaction like anaphylaxis. Only 1 case report death. But the good thing that blood clot case report after 1.5 million doses. Government also working on the vaccination passport. You know, they control every medical facility who will provide the vaccine need to have the electronic medical record, and they working on the QR codes. So this one will help the vaccinated people to get recognized, identified not only in province, but it will be identified in the whole country, and it linked to the Department of Immigration, and this one will help later on for travel. And the next step from the government is they not only approve for the people who got vaccinated, but they will request the blood test for serology titer. That means you have a certificate to show that all you got infected by COVID-19. Now you get recover, you get the evidence of antibody, or you got a vaccination and you got a evidence of antibody in your blood test. And another news from Vietnam, you know that it happened only 2 weeks ago, that now the government, now they authorize, they allow the private sector get involved to vaccine. So that means they authorize the pharmaceutical company, they provide a list of 36 pharmaceutical companies who have a license to import the vaccine. However, this company need to meet the criteria. They need to have a storage, they have a legal permission from the government. And whenever they import the vaccine, they need to have a network to work with a medical company like hospital and clinic to purchase the vaccine. However, that is good news. So that means for commercial vaccine, so people in Vietnam, if we have more choice, not only AstraZeneca, you will have a Pfizer, Moderna, Johnson & Johnson, or even the Chinese product like Sinopharm, it will be right to Vietnam. So government also now allow every city or province, they have their own decision to import the vaccine. So that is quite good news. Next slide, please. Okay, so another information for you that in Vietnam, you know, we have also a local vaccine. The first one is Nanocovax. So this one from Nanocogen pharmaceutical company. So the good news that they do a clinical trial in phase 3 now. So far the report is good. So they got very good efficacy, good response. And the government try to support this, and we hope that it could be available next year in quarter 1. The other one is Covivax from EVA company, but this one is so early, it's still on clinical phase 1. And you know, until now, the Vietnamese MOH already approved 4 vaccines. So AstraZeneca, Sputnik V, Sinopharm, and a few days ago they just approved Pfizer. Next slide, please. Okay, so you know the vaccination campaign in Vietnam is, until today, is still focused on the priority group. So everybody, you know, this link already. So it focused on the public sector. It's not a private yet. So until today, there is a little bit delay compared to the plan. So until today, only we have provided up to group 5. That is police service, and the teacher in group 6 is still waiting. So we hope that whenever we import more vaccine, we hope that the vaccine from COVAX facility will arrive, then the government push on that, it making faster. So the good news, like today, we have received another nearly 1 million dose of AstraZeneca from the Japanese government. So it just arrived this morning. So this one will transfer to Ho Chi Minh City. They will switch to the hotspot in Ho Chi Minh City to cover for the people in the high risk. Okay, next please. Okay, so you can see this is the plan from the government. So you know the government, they are working with Moderna to sign agreement to get a 5 million dose of Moderna vaccine. And they say in May, from May up to the end of the year, we will receive this one, but we don't know when. So we're waiting for this. For AstraZeneca, there is 2 shots. One is from COVAX facilities. Yeah, everybody knows that we receive up to today, we receive 2.9 million doses already. And besides that, the government also signed to purchase 30 million doses of vaccine AstraZeneca as well, and it will come to Vietnam during this year and next year. And the government also say they already have agreement to purchase 31 doses of Pfizer. So, but however, they say it will come in later on quarter 3 or quarter 4 this year. So we wish that will come soon. And the newspaper today, they say Pfizer vaccine, the first lot will come next month, so in July. So we hope it come more and more, and we have good news. Until today, you know, BNVC only a company who got authorized from government to storage the vaccine, and because they got a 50 medical clinic in Vietnam, so they are the first one to authorize, to storage, to import, and to deliver the vaccine. However, they are not only one. So in the future, many clinic, hospital from private sector will join this one when the commercial vaccine available in Vietnam. Okay, thank you.
Thank you. Thank you very much, Dr. Phi Truong, for this very complete presentation. Maybe we can stay with international SOS with Dr. Jean-Samuel Wartel, Medical Director, Assistant Services Asia, maybe for general information on the region, on Southeast Asia, and to talk a little bit about the expertise of international SOS.
Thank you very much, and good afternoon, everyone. So I'm pleased to share with you some information regarding the COVID-19 situation in Asia region. After a short introduction, I will go more specifically on the COVID-19 outbreak in this region, and then I will share with you some experience regarding a medical evacuation capability during the COVID-19 pandemic. Next slide, please. Next. Okay. So the good news is that this last week was the lowest weekly case incidence worldwide since February 2021. However, we still have 3 million new coronavirus cases reported per week. And the declines of the number of new weekly cases compared with the previous week were reported in all regions over the world except in Africa. So many factors can explain the situation, and not all countries have responded in the same way, and not all countries have been affected in the same way. However, we need to consider the COVID-19 vaccination campaign in several countries are contributing to controlling the spread of the disease. Today, 21% of the world population has received at least one dose of COVID-19 vaccine, 21%. Let me share with you some other numbers very quickly. Europe, 45%, only for one dose. USA, 52%, Israel, 63%, and Canada, I was quite surprised with this number, 65%. And as mentioned before by Dr. Thomas, the development and approval of the safe and effective vaccines 1.5 years after the emergence of the new virus is an incredible scientific achievement. More specifically now, if you look at the WHO Southeast Asia region, so including Thailand, Indonesia, India, we can see a recent and significant decline of new COVID-19 cases, mainly due to the fact that in India, the situation is doing much better if you compare end of May and early June. In these huge regions, 300 million of doses of COVID-19 has been administered, and 80% only in India. Today, 15% of the India population has received minimum one dose of vaccine. And Thailand, however, the situation is not so good. They are facing the third wave outbreak, and Bangkok is the epicenter, with another month of triple-digit new cases reported daily. 2 vaccines are available in Thailand, Sinovac and AstraZeneca, but today only 8% of the population receive one dose and 3% of the population receive 2 doses. With this significant number of clusters, specifically in Bangkok, school remains closed in Bangkok until minimum the end of June. In other parts of Thailand, sometimes the schools are still open. If we go through another part now, what the WHO called the Western Pacific region, including this time 70 countries, including Vietnam, Cambodia, Singapore, Australia, the number of new cases is quite low, as you know, and quite stable. But the number of deaths increased compared with the previous week. However, it's nothing compared with what we are facing recently in Europe. Few information regarding on the regional point of view. Singapore, 46% of the population is vaccinated, and they started early June to start the vaccination for young children, 12 years old and above, with the Pfizer vaccine. Malaysia as well, quite unstable situation. I have some colleagues over there. And they say that unfortunately only 10.5% of the population receive one vaccine. Next slides, please. Let me give you some information regarding the variants. On one hand, so we have a highly efficacious vaccines using the original strain, the strain that we have, the Wuhan strain, helping flatten the epidemic curves. But then why are emerging variants a concern today? In fact, those variants contribute to increase the number of new cases. They are associated with a high transmissibility, higher risk of hospitalization, and higher risk of mortality. Let's look at what happened in India and what happened as well in UK. The second question is, do the authorized vaccine protect against the new variants? Based on the several clinical studies, protection induced by the vaccine remained against the alpha variant, but the protection level against the beta variant is lower compared with the original strain. And there is still limited data for the other variants. So therefore, there is a need to do some clinical trial to confirm the vaccine efficacy against the new variants. Research is ongoing. And there is a need to develop more vaccine to address the global supply issue, particularly in Asia, and to do more clinical research. For instance, something quite interesting, the clinical trials on the interchangeability. If you receive one dose of AstraZeneca, can you receive for the second dose of Pfizer? This is a true logistic and programmatic question. Next slide, please. Let's go to the medical evacuation process. So as you know, International SOS is highly experienced in evacuation patient with or without infectious disease. International evacuation of patients is always a challenge, and the situation is even more complicated during the COVID-19 period. History of travel from or to a COVID-19 affected location may require a significant additional time frame to undertake, and some patients may experience significant delay of the evacuation. Our aircrafts are available 24/7. Our ICU flight team, we have an ICU flight team standby 24/7 in Singapore. However, additional tests are required now, and we need to obtain the authorization of the health authority in the originary country to discharge the patient, and we need the authorization of the health authority in the designated receiving country. This situation is changing. A few months ago, it was every day, I would say. Now it's every week. And for example, now in Singapore and Thailand are accepting only patients requiring urgent medical care. South Korea, Japan have implemented temporary suspension of the visa, and therefore medical evacuation to those countries is not an option at present. We need to consider as well another thing, which is the quarantine. So of course the patient, when you will, it could be a patient with a COVID-19 disease or not, but anyway, they will require the patient to do a quarantine. We recently organized a repatriation of the Austrian lady. When she arrived in Sydney, she was obliged to be in quarantine for 2 weeks. And it will be the same issue for our medical team as well, which is a big concern for us. And we have another problem, which is the reduction of the flight services by several carriers. When we have been able to do direct flights sometimes before, now may require several stopover now. And usually you are supposed to go to Singapore and South Korea most of the time in the Asia region. We recently organized another repatriation for an American gentleman from Ho Chi Minh City to Kansas City. And I can tell you, it was a real challenge on the medical point of view and on the logical point of view. Next slide, please. So let me now be more focused on the evacuation capability for COVID-19 patients. So we did several repatriation, because forget the evacuation of the COVID-19 patient. Singapore, Thailand, anywhere, majority of the country over the world, they will always refuse a patient who is COVID-19, except if it's a national person. So you can organize a evacuation to Singapore and Thailand if the patient is Singaporean or if it's Thai. If the patient is French, most likely we need to look at the potential repatriation back to France. And we are using now a new portable medical isolation unit, PMIU, with a high efficiency particular air filtration. You can read on this slide the logistical, medical, organizational challenge that we are facing when we are organizing such an evacuation or repatriation, sorry. I'm not going to list all of them, but remember only one, the claustrophobia and the scare of getting into a PMIU coffin is something that we need to consider, requiring optimal preparation of the patient prior to organizing the repatriation with the PMIU. So in order to prepare the repatriation of these gentlemen and make sure that the patient will accept the transportation, we send our medical team in Jakarta to the hospital with another PMIU, loaded the patient in the unit, and make sure and confirm that he will tolerate the medical device. I think now it's for you, Marion. The floor is yours.
Thank you very much, Doctor. And actually, it was very interesting. Thank you for your inputs. And actually, hello everyone. So very happy to be with you today. So I think from my perspective, so we're going to discuss, the obligations and potential rights of, the employer, how, the COVID-19 and the vaccination campaign can affect the employment relationship. So maybe we can move on to the next slide, please. Thank you. So a question that we get a lot from our client is whether today an employer can require its employees to be vaccinated. And right now, unfortunately, there is a clear answer that we can provide, because in the current status of the law, it is not possible. Since, the vaccination is not available to everybody, but it's still reserved to a specific category of people, then of course, an employer cannot require its employees who do not fall into these specific categories to be vaccinated. I think what is very interesting is that probably things will evolve with the time, and it's still a developing area, of course. And once indeed, there will be enough vaccine for everybody, and on this day, employers indeed, and especially when there is a specific requirement due to the specific sector or industry, employers could perhaps ask as a prerequisite of the hiring to have its employees to be vaccinated. So I think probably if the employer wants to impose this, it will need to amend what we call internal labor rules. So this will apply to employers with 10 or more employees. And if indeed, because by law under Vietnamese law, so employers with 10 or more employees must have internal labor rules, and these internal labor rules must be registered with the labor authority, which is called the DOLISA. So it will be interesting to see whether the DOLISA will accept or not, a provision in the internal labor rules asking the employees to be vaccinated. So yeah, I think it will be, there's going to be a lot of change in the coming months. Another question that we get is still the same. Assuming that the employer asks the employee to disclose its medical record before the hiring, can an employer require its employees to be vaccinated as a prerequisite of hiring? So the same principle will apply, meaning that right now, normally it's not possible. The difficulty here is that normally there is a provision in the Vietnamese labor code that says that as an employer, you cannot discriminate any employees on the grounds of, religious belief, sex, gender, and also medical condition. So right now, normally employers should not refuse, the access of a specific position to an employee who is not vaccinated. Of course, the difficulty will be to prove that I mean, I was personally, rejected by my application was rejected because I was not vaccinated. Because in most of the case, the employer will invoke, other factors like such as, the employee was not qualified enough or did not have any sufficient experience. So yeah, this will be a matter of proof for the employee. Another question that we get is, okay, I mean, as an employer, I work in a specific industry and there is a specific risk incurred. If, I offer and I encourage my employees to be vaccinated, if they refuse, can I terminate an employee on these grounds? So again, we don't have any specific mandate right now. We'll see in the future whether the government will allow an employer to do that. Right now, for those who are familiar with Vietnamese law, the Vietnamese labor code actually provides a specific list of situations where an employer can unilaterally terminate an employee, and if it does not fall into these situations, then the employer may not terminate the employee. And refusal of being vaccinated does not fall into this category, so it's not applicable. And the last question also, and this might be interesting for the audience, is okay, we know that there is a risk. Can, as an employer, ask employees who refuse to be vaccinated to come to the workplace to protect the others? And here, I mean, it's a very interesting question because on one hand, you have the necessity as an employer to ensure the health and safety of your employees. And on the other hand, you also need to sorry, I lost what I was saying. So yeah, you need, as an employer, you need to have a balance between protecting the employees at the workplace, but also ensure that these employees perform their work properly. And this is actually very interesting in terms of Vietnamese labor and employment, because the workplace, the place of work, form part of the mandatory content to be provided in the employment contracts. And normally, if one party does not comply with the workplace and does not come to the agreed place of work, then it can be construed as a breach of contract. But the government of Vietnam, of course, took into consideration the specific features of the current situation, and actually encourage employees to work from home. And I think now with the last wave, a lot of companies have actually implemented this. So from a strict legal perspective, since there is this recommendation from the government, it should be fine. But in general, we recommend at least sending a letter to the employee saying that, okay, for this period you will work from home, and if to the extent possible the employee should agree on this, or at least acknowledge and agree on this arrangement by responding by an email or something. But yeah, this is recommended to pursue this course of action.
Thank you very much, Marion, Carl from DFDL for these questions, for these answers to many questions. We do, as a chamber, receive a lot of questions, and we are very happy to bring together our members, the questions and the expertise of our members from DFDL, from International SOS, and of course from the embassy. So we almost reached 250 participants today, so it's a bit overwhelming with the questions. We received a lot of questions. I will try with let's say 15 minutes left to ask some questions to the panelists. Before that, I would like to thank you for your valuable support, your contributions. I think you enabled the best information to be disseminated to the audience. And when I see 200 people, I'm happy that we could share all this information today. The first question I might ask would be for the embassy. We start with our first panelist with a very general topic. It would be what does the embassy do for the vaccination of the French, I guess the French people living in Vietnam? For first question for the embassy, for Dr. Thomas Mourez.
Thank you, Adam. Can you hear me? Yeah?
Yes.
Okay. With regard to vaccination, the principle adopted by the French authorities is that the French people living abroad should, as far as possible, be vaccinated in the countries where they live. But the Vietnam does have vaccines, but you know, we have seen it in limited quantities. In addition, the vaccines that are available at this stage, mostly the AstraZeneca provided by the COVAX facility, these vaccines are dedicated to the target populations defined by the government of Vietnam. We have seen the list of people targeted by the vaccination. So the Minister of Foreign Affairs, Jean-Yves Le Drian, has stated that a solution will be found so that French people living abroad can be vaccinated. That's why the ambassador has met the Ministry of Health, the Professor Nguyen Tran Long, last week to discuss about this problem. And in fact, the discussion, the answer of the minister was really positive. And the embassy is now in close contact with all the different Vietnamese authorities to find a solution, the Ministry of Health, the city of Hanoi and the city of Ho Chi Minh City. And we must be aware that we are at the beginning of the process. And there are a lot of complexity in the discussions. So no other country has at this stage imported and administered the vaccines for all its nationals in Vietnam. Only very few embassies have done it for their staff, but not for all the national residents. So we are at the beginning of the process. Nevertheless, we study all the different possibilities to provide the vaccine to the French community as soon as possible. It can be in a few weeks. And we are really confident that we will manage to do so.
Thank you. Thank you very much, Dr. Thomas Mourez, for this answer. It's very interesting, and we are of course very enthusiastic about this initiative from the French authorities. Thank you. Maybe one other question, maybe very quick. What is the situation in France now? How maybe it can mirror the situation here in Vietnam?
What is the situation in France? You know, after many difficult months, the situation is really improving. The Professor Jean-François Delfrécy, who chairs the Scientific Council advising the President Emmanuel Macron, has even just announced that the situation is improving faster than expected. And all the law, in fact, will move forward to give more liberty, more freedom to the people in France. Until now, almost 40% of the French population has been vaccinated, at least with one dose, and we are starting to see the first effects. This situation, in fact, can be seen in all the countries that have implemented widely the vaccination, like in the USA, like in Israel, we have seen in Canada, in the United Kingdom, where the number of deaths every day drops significantly. So it's improving quite well.
Great. It's great news. Thank you. Thank you, Dr. Thomas Mourez, for this. I will go maybe to another questions. Two other questions, maybe two questions in one for DFDL about money. Do employees have to pay wages to employees who are infected by COVID-19? And do employers have to pay the treatment costs for employees infected with COVID-19? Do you have some insights on this tricky question?
No, sure. And this was actually anticipated by the Vietnamese government. There is an official letter 1064, that expressly says that employees, who are put in quarantine by order of the Provincial Steering Committee of Vietnam, or who must cease work due to the shutdown of the company, or again who are put in quarantine as a result of, because in Vietnam apparently if your colleagues are put in quarantine, you need to quarantine yourself. So it's like, you know, a kind of escalation. So in this case, this official letter says that the employee must receive, you know, the salary. There is, however, the possibility, and this is under the Labor Code 2019, to agree with the employee on the salary that the employee will receive during such a period. There is a condition that, you know, the salary may not be lower than the minimum wage level, but there is still a possibility to negotiate with the employee and adjust, you know, the salary downwards. And in terms of the potential costs related to the treatment, so actually, if the employee is sick, he or she will be covered under the social security regime. And the government also announced that, you know, the treatment will be free of charge for the employees. And there is even more, because there is a recent decision dated 19 May, that provide financial support for the employees working in Vietnam who are infected with the COVID-19 and who receive treatment. And there is a provision that say who have not violated any regulation regarding COVID-19 prevention or control. So these employees can receive a financial support of up to 3 million Vietnamese dong.
Very good. Thank you very much, Marion, for these insights. We have so many questions. I will try to identify maybe one question regarding the vaccination. When do you think vaccination for under 18 years old would be available? Maybe for Dr. Phi. And another question, maybe technical question for Dr. Phi, a complicated one, I'm sure. Depending on the vaccine, how long does the immunization last? Dr. Phi, two questions for you.
Okay, thank you for the question. So, and you know that in the world now, the vaccination with approved for children is Pfizer. So Pfizer today, they got FDA that approved the vaccination for children from 12, 17, and now it's from below 12 years old as well. And another one in Moderna, they have the statistic to say that if you get 90% efficient for children as well, but however, it's not approved yet. So up to today, Pfizer is the one that got approved from the FDA for children. So as I mentioned that they hope next month in July, we will receive the first number of dose from Pfizer. We arrive in Vietnam next month. And the second question, I just answer in the chat box. So so you know we need to have more data. Normally after the first dose, we need 2-3 months to get a data to follow up the antibody level and how long the is last, how strong is that. And after second dose, we need to collect the data for another 6 months as well. So we don't know how long the immunization lasts. But the scientists advise that we maybe need a booster dose, the third dose. A lot of people think at least we cover 6 to 12 months. But we need too early to say. We need to monitor that statistic number.
Very good. Thank you, Dr. Phi, for these answers. One more question for the embassy. I have so many questions for the embassy. One would be, I take one maybe regarding the charge. Some people are asking if the embassy succeeds, the French authorities succeeds to import vaccines here in Vietnam. How would it work in terms of money-wise? I'd say, would it be a charge for this? How would it work? Do you have any insights on this already?
Yes, we have a few ideas. In fact, the vaccine will be free of charge for all the eligible people. For the vaccination itself, in fact, we are studying different possibilities. We don't have answers yet because we don't know, in fact, exactly where the vaccination will be settled. So depending where the vaccination will be settled, we will find a solution to make it free or with a very few charge.
Very good. That's also a good news. Again, we have a lot of questions. What we can do at the end, because we have around 50 questions right now in the box, so we'll try maybe together and to create some master question, and maybe day after day to try and answer these questions as we do already on the website. I have another question, maybe a legal one for DFDL. Maybe I'm not sure to understand exactly. Are there any potential liabilities faced by foreign invested companies regarding severe adverse events of a vaccination campaign organized by local authorities in the company's premises? Is it clear enough?
Yeah, so I mean, that's an interesting question. And there is actually a decree. So this is decree 104 that provides that, you know, when there is a national epidemic and, you know, if the vaccinated person suffers after the vaccination from serious injuries that may result in disabilities or potential, you know, the death of the person, then the states or the government of Vietnam should be liable for providing compensation to this person. There is a provision that says that I'm doing a quote here, that the organization and individuals involved in causing the damage should reimburse, you know, the government of Vietnam for the compensation amount. There is no actually guidance. There is no guidance on how, I mean, what does that mean to be involved in, you know, causing the damage. So it will depend on the actual, I don't know whether, you know, the employer lied about the vaccine available. I have no idea, but I think if the employer must be held liable, then it needs to be like, I would say, a misconduct from the employer. So apart from this situation, in principle, and yeah, I don't see how, you know, an employer that will, you know, facilitate, you know, by putting at the employee's disposal, the workplace could be held liable. But again, this is a developing area, so I mean, the question may change in the future. Unfortunately, I don't have a clear answer right now.
Okay, thank you, Marion, for this answer. Unfortunately, time's up already. It was quite a challenge to fit in 60 minutes, also to fit in everyone's agenda. What I would recommend, we received a lot of questions right now. We will gather this information, try to answer them on the website as we do already. Please go and check the website of CCIFV. We try to share all the official information we can have and we can understand. What's important now is maybe to keep the conversation going. Do not hesitate to use the website, our emails. If you are members, you have you can log in on the platform and ask your questions. You can also get in direct contact with the panelists today, or go through the CCIFV. And that's it. We hope the webinar was very insightful. We learned a lot. Thank you very much. We had more than 200 people attending the event. We will maybe have to organize another one in the next weeks or months. Thank you very much. Please stay in touch. I would like to thank again the French Embassy for these insights. Again, it's a very optimistic and enthusiastic approach. Thank you very much. Thank you to International SOS, and thank you for DFDL for coming also today. I wish you a great day, a great end of the week, and let's keep